Buenos días para todos y todas. Les damos la más cordial bienvenida a este seminario virtual. Antes de comenzar con la agenda, me gustaría informarles que este evento dispone de interpretación al español, inglés, portugués y francés. En el borde inferior de la pantalla pueden encontrar el icono de interpretación donde pueden elegir el idioma de su preferencia. También pueden enviarnos sus preguntas por medio del botón Q y A, ya que tendremos un tiempo al final de las intervenciones para responderlas. Mi nombre es Evelyn López y soy parte del equipo de comunicaciones del Programa Especial de Inmunización Integral. Hoy, junto a expertos de la OPS, conoceremos los puntos más importantes de la publicación Comunicación de los riesgos relacionados con la vacunación, así como los aspectos prácticos que nos ofrece. Para comenzar, invito al gerente ejecutivo del Programa Especial de Inmunización Integral, el doctor Daniel Salas, para que pueda dar las palabras iniciales de este seminario. Adelante, doctor.
Gracias, Evelyn. Muy buenos días a todos los que se están uniendo a lo largo de toda la región de las Américas. De verdad que es un gusto estar con ustedes compartiendo un espacio tan importante. Yo creo que la comunicación sobre los riesgos relacionados a la vacunación es un tema que tenemos que darle mucha importancia. Sabemos que ha habido por mucho tiempo una tradición fuerte en los programas de vacunación en las Américas y hemos logrado coberturas bastante altas. Incluso nos han permitido esas coberturas eliminar o certificar la transmisión de la eliminación de muchas de las entidades que provocan enfermedades importantes por vacunas. Pero las vacunas, como cualquier otro medicamento o intervención médica, tiene claro que tiene un riesgo también de provocar situaciones adversas. Sin embargo, este riesgo ya está muy estudiado. Se ha demostrado reiteradamente que en la gran cantidad de casos, cuando existe, cuando se presenta, cuando se materializa, es mínimo y sobre todo los eventos que ocurren son pasajeros y sin dejar un problema permanente. Claro que también pues existirán eventos adversos un poco de más gravedad, pero para eso también tenemos un sistema de farmacovigilancia que es importante también trabajar y fortalecer y siempre sobre todo ser transparentes con la población. Yo creo que parte de lo que caracteriza el éxito de un sistema, de una intervención médica, de un medicamento es indicarle a los que se van a beneficiar de esa intervención también cuáles son los riesgos. Y eso es importante transmitirlo con seguridad, con propiedad y sobre todo explicando muy bien cuáles son los beneficios, porque usted no debería comunicar cuáles son los riesgos si no existe un balance claro de cuáles son los beneficios. Y en eso las vacunas tienen muchísimo que aportar, ya todos lo sabemos de que en general la mayoría de las vacunas tienen una capacidad de prevenir enfermedades y en muchos casos de prevenir cuadros graves, incluso mortalidad. Entonces, cuando vemos ese gran beneficio, sobre todo que es un beneficio que se transmite colectivamente, que no solamente se queda en el ámbito personal o individual, logramos proteger comunidades, logramos proteger sociedades como un todo, y no solamente la parte de salud, sino todos los sectores de la sociedad. Es muy importante siempre hacer ese balance y poder transmitirlo con toda la transparencia y con toda la seguridad. Por eso, desde la Organización Panamericana de la Salud, alentamos siempre a nuestros Estados miembros a que se esfuercen para fortalecer esa confianza en el público que más que nunca se hace clave en los programas nacionales de inmunización, en el beneficio que tienen las vacunas, pero también obviamente en los riesgos que, como indicamos anteriormente, en la gran cantidad de casos, cuando se materializan, son transitorios y son mínimos. Y es importante también hacer que haya una participación social efectiva en ese tema, que podamos tocar a los diferentes actores sociales, que podamos tocar los niveles políticos, los niveles estratégicos, que todos estemos enterados también de cómo podemos hacer una comunicación de riesgo efectiva en tema de comunicación para poder avanzar hacia lo que tanto queremos, que en este momento es una recuperación de nuestras coberturas. Recordemos que en el 2021 el reporte de las vacunaciones a nivel mundial, el reporte WINIC, nos puso en penúltimo lugar a la región de las Américas en términos de vacunación. Y eso vimos en el 2022 una leve recuperación para la mayoría de las vacunas, pero tenemos que seguir trabajando. E insisto, la comunicación de riesgo, la transparencia, la comunicación oportuna se hacen preponderantes para lograr ese objetivo. Así que los invito a sumarse, a participar, en todos los foros que sean necesarios, a fortalecer su capacidad de transmitir esa información con confianza, de forma oportuna, de forma transparente, de forma accesible. Y les agradezco mucho, obviamente, que estén presentes hoy. Espero que la sesión les sea de mucha utilidad y que juntos podamos fortalecer nuestros programas de inmunización, tanto en este momento como en el futuro, que recordemos también que existen muchas vacunas que van a estar disponibles en poco tiempo y eso también representa un reto adicional de ir conociendo, de ir fortaleciendo técnicamente las capacidades y los conocimientos sobre las vacunas que ya tenemos y sobre las vacunas que van a entrar en los próximos años. Así que muchísimas gracias por su atención y les deseo muchos éxitos en este tiempo que van a compartir.
Muchas gracias, doctor Salas, por sus palabras y por recordarnos que el impacto de la comunicación de riesgo en la confianza hacia las vacunas. Vamos a retomar la agenda. Me permito presentarles ahora a Gabriela Andraca. Ella es consultora de comunicación de la Organización Panamericana de la Salud y nos compartirá los materiales de comunicación que la organización ha desarrollado relacionados a la vacunación. Por favor, Gabriela, adelante.
Hola a todos, ¿cómo están? Yo soy Gabriela Andraca. Pongo la presentación. Me indican por favor si la ven.
Todavía no la vemos.
¿No?
No.
A ver, un momento, porfa. Listo, una disculpa, ahí está.
Ahora sí.
¿Ya? ¿Se ve muy claro? Ok. Listo, una disculpa. Hola a todos, soy Gabriela Andraca. Buen día, buenas tardes. Soy consultora de comunicación del programa especial de inmunización integral. El objetivo de mi presentación es compartirles los principales documentos que hemos publicado en la OPS alrededor del tema de la comunicación de crisis y pues que anteceden a este documento que hoy se presenta. La idea es que conozcan estas publicaciones, cursos y materiales a su disposición y esperamos que pues, les pueda ser útiles en su trabajo diario y en su labor también de comunicación. Bueno, este es el primer documento, la comunicación de crisis relacionada con la seguridad de las vacunas y de la vacunación, orientaciones técnicas. Básicamente brinda apoyo para elaborar un plan de manejo de crisis relacionadas con la seguridad de las vacunas. Y en caso de que ya tengan un plan, es muy útil para optimizar la elaboración de sus planes de comunicación, para recuperar, mantener y fortalecer la confianza en las vacunas, básicamente, así como la vacunación y pues también los programas de inmunizaciones en general. Este documento tiene su curso de libre acceso para el público interesado y se divide en 4 módulos con información, ejercicios y un examen final. Se completa súper rápido en 2 horas y al terminarlo se proporciona un certificado de aprobación expedido por la OPS. Así que búsquenlo, lo pueden hacer súper fácil. Otro documento que tenemos es comunicación sobre la vacunación segura, orientaciones para apoyar al personal de salud en la comunicación con madres, padres, cuidadores y pacientes. Básicamente da a los trabajadores de la salud herramientas de apoyo para una comunicación efectiva con la población general, con el objetivo de fortalecer, igual, mantener y recuperar la confianza en las vacunas y en los programas de vacunación. Este documento también tiene su curso, está dividido en 6 módulos y se completa en solo 3 horas. También tenemos esta guía para elaborar una estrategia de comunicación de riesgos sobre las vacunas contra la COVID. Facilita la planificación y el desarrollo de la estrategia de comunicación de riesgos y la participación comunitaria para la vacunación contra la COVID, básicamente. También como sabemos que uno de los factores clave para el éxito de la inmunización es el compromiso y la dedicación de ustedes, los trabajadores de la salud, que también están aquí presentes, y en la promoción y en los servicios de las vacunas son súper fundamentales. Elaboramos esta encuesta en el 2021 para conocer las actitudes e intenciones justamente de los trabajadores de la salud en 14 países del Caribe y en relación también con la inmunización y la vacunación contra la COVID. Hicimos varias preguntas clave y los hallazgos los compartimos en este documento de preocupaciones, actitudes, prácticas previstas de los trabajadores de salud con respecto a la vacunación contra COVID en el Caribe. Y para mejorar las estrategias de vacunación, o sea, bueno, este documento es básicamente igual para mejorar las estrategias de vacunación, adaptar enfoques de comunicación y contribuir y aumentar la aceptación de las vacunas. La última encuesta que elaboramos es esta. Tiene el mismo enfoque que la pasada, solamente que esta fue implementada en 16 países de la región. Estamos conscientes también de que el personal de salud corre el riesgo de recibir información errónea de las vacunas y con esta guía, bueno, con esta encuesta que al final hicimos el documento, queríamos saber cómo piensan, cómo sienten, cómo actúan y bueno, con esto plasmamos todas las ideas para que al final se puedan desarrollar estrategias y se incremente igual la aceptación y el uso de las vacunas. Esta publicación tampoco la queríamos dejar pasar, el modelo centrado en las personas para adoptar los programas de inmunización de la OMS y UNICEF. También la quisimos compartir con ustedes por la importancia para identificar y superar obstáculos o también para aprovechar las oportunidades para la inmunización. Aquí se explican las 4 fases del modelo: diagnóstico, diseño, ejecución, evaluación. Sobre todo, y también, bueno, sobre todo también refuerza la capacidad para escuchar y aprender para comprender a la comunidad, básicamente. Esta metodología de los diálogos de los saberes está enfocada a mejorar el acceso y la cobertura universal a la salud a través de diálogos interculturales con grupos y comunidades de diferentes orígenes y culturas. Y esta metodología es súper interesante porque también se puede aplicar en el trabajo colectivo, ya sea con migrantes, con desplazados, adolescentes, personas mayores y con distintos grupos que ustedes quieran aplicarlo. Igual para mejorar una estrategia de comunicación y tener una mayor efectividad. También tenemos 9 guías para el diálogo sobre la vacunación contra la COVID. Es un formato súper bonito, que es muy chiquito, que se puede llevar en la bolsa y es pregunta y respuesta. La idea con la que hicimos este documento fue para que los vacunadores o las personas que vayan casa a casa puedan tener una guía tal cual, con las preguntas que las personas les hacen y puedan responderlas con la mayor, de una manera eficaz y didáctica con las personas y se basa principalmente en argumentos científicos, pues. Es súper interesante porque abarca varios temas como la vacunación durante el embarazo, la vacunación y consideraciones sobre la fe cristiana, como pueden ver ahí los títulos. Y estas guías contribuyen también a la lucha contra la desinformación principalmente y las teorías negacionistas minoritarias, pero pues que al final siempre repercuten en los esfuerzos de vacunación. Entonces, con estas preguntas y respuestas, si ustedes las ven, pueden dar mejores argumentos a las preguntas que comúnmente tiene la gente en campo y para que lo sepan enfrentar. Ya sea que le echen un ojo antes de ir a campo o que ahí mismo la puedan consultar si es que no saben cómo contestarle a una persona acerca de las vacunas. Por último, bueno, antes de terminar, quisimos también agregar estos consejos para verificar la información sobre las vacunas contra COVID. Es una guía de periodistas, para periodistas específicamente, que brinda herramientas prácticas para comunicar de manera responsable sobre la vacunación y las vacunas. Esta guía la elaboramos a partir de un taller con las personas de Chequeado, igual muchos de ustedes les resuena, que es una red de combate a la desinformación en Latinoamérica muy bien conocida. Y también es útil para fortalecer las capacidades de verificación de información para periodistas específicamente de América Latina y el Caribe, porque ustedes saben que es bien específico en el público de la región. Y por último, no queremos dejarles de compartir también que tenemos una playlist en el canal de la UPS en YouTube, PAHO TV, y pueden hacer uso de estos videos también como apoyo con alumnos, pacientes o hasta para proyectar en pantallas en los hospitales o consultorios o en donde ustedes requieran. Échenle un ojo también. Y bueno, al final no duden en contactar a su oficina de la OPS para más materiales e información que necesiten o que igual y no saben que existe, pero pues pueden preguntarles y pues capaz por ahí tienen algo. Bueno, pues muchas gracias por su atención.
Gracias, Gabriela. Les recuerdo que pueden escribir sus preguntas dando un clic en el botón Q y A, ya que también tendremos un espacio para responderlas. A continuación tendremos la intervención de Lauren Bulanovich, consultora de comunicación de la OPS. Ella presentará el contenido de la publicación Comunicación sobre los riesgos relacionados con la vacunación. Lauren, el espacio es tuyo.
I'm switching to English so I can get through my presentation a little bit quicker. Good morning to everyone, and thank you so much for being connected. We know how busy everyone is and appreciate you taking the time to learn a little bit more about this important topic of communicating about vaccination-related risks. So in my presentation, we'll go over a couple of different topics, why we should be talking about vaccination-related risks. We'll talk about a new publication that PAHO has just released that's available in English, Spanish, Portuguese, and French. We'll look a little bit at the factors that influence vaccination-related decisions, how those are made by the general public. And we'll also talk about how we can apply risk communications and community engagement principles to communicating about vaccination specifically. And then we'll get into a little bit of the practical guidance, which is what we see in this new publication. So first of all, why should we talk about risks related to vaccination? I think everybody here, after what we've seen happening with COVID-19 vaccines, where we've seen lots of rumors, misinformation going around. I'm sure we all know people who have had some doubts or some questions about the vaccines. Are they safe? Do they work? So why would we bring attention to risks if that could possibly raise doubts more? Well, the fact of the matter is that even if the risks are minor, or even if they're rare, they exist. And by pretending they don't exist, we're not doing anybody any favors, including ourselves, right? So when we can talk about risks, we can help our audiences know what to expect when it comes to vaccination. And that's really important for the general public to know. So when they don't feel like they're being misled or lied to. It's also really important for health workers to know, like Gabriela had just mentioned, the importance of healthcare workers as being the face of immunization programs, right? So when our health workers know what to expect in terms of risks related to vaccination, they can communicate these better with people who are seeking vaccination services. By being transparent and talking about risks, we're also building trust, which is a topic that we're going to come back to over and over and over again in this presentation. And I'm sure you've heard, if you've connected to other presentations from PAHO in the past that are related to communication and vaccination, you've heard us talk about why this is so critical, why it's the bedrock of immunization programs. And having that trust, and why that trust is so important in the case of an emergency, whether that's an adverse event in a SAVI following vaccination, or if it's the introduction of a new vaccine, whatever it is, we want to have that trust with our different audiences. So just a quick reminder about if you've heard or seen this acronym of RCCE, risk communication and community engagement. This is just really important to remember that they're essential components of a broader health emergency preparedness and response action plan. And that when we're talking about public health emergencies, this can include the actions that are required through preparedness, response, recovery phase, and that, again, you see the mention of trust here. We really want people to feel like they have the information so they can make the correct decisions, like get vaccinated, right? And then maintain the trust and that maintain trust with our different publics. So because we had seen that there were some needs around the region in terms of communicating about vaccination-related risks, we developed this new material. And it is available, like I said, in all 4 PAHO languages. And we'll get into it a little bit more throughout this presentation. But what you want to know is that the material includes framing of vaccination-related decisions, so how people make those decisions, talks a little bit about vaccination hesitancy, advocacy. The framework, the theoretical framework that we use are those same RCCE principles, which I'll also touch on a little bit more. And then we get into the practical guidance, right, on how to follow RCCE principles when we're communicating specifically about vaccination-related risks. Handling false information, such as pre-bunking, which is where we inform the audience and the public that they might be exposed to some false information about vaccination, about vaccine safety, whatever topic it is. And helping to prevent that false information from taking hold in people's minds, as well as debunking, which is how we correct that misinformation, that false information, once people have already been exposed to it. It also has guidance on messaging, managing risk perceptions, collaborating with partners, and pharmacovigilance, as well as real-world examples of things that different countries have done that have worked and things that haven't worked quite as well. And this publication really is in line with part of the series of the materials that Gabriela just presented in terms of crisis communication, interpersonal communication. It's kind of a logical progression. So please feel free to check it out. We hope it's a useful resource for you. So let's look now at some of the factors that can influence some vaccination-related decisions. I'm sure people have seen this continuum of vaccine hesitancy and demand in the past, if they've connected to different PAHO presentations about communications and vaccination. There's a couple of things that I want to just highlight here. And this is the fact that, a lot of attention has been paid to anti-vaccine groups or anti-vaxxers, right? And the majority of the folks and the public, there's a really strong support for immunization, especially the routine program. And I'm not sure if you can see my mouse moving, but just know that when we're looking at this supply of one end, people actively demanding, they're supporting vaccination, they're seeking vaccination services. And then on the other end, that very small point of folks who reject all vaccines, most people are in the demand or passive acceptance, where people accept the vaccination, and that in the yellow arrows, the orangish arrows there, when it comes to vaccine hesitancy, this is something that's very fluid. It can depend on the context. So somebody can have a question about a specific vaccine or who the vaccine is for. And then depending on what kind of answers they get to those questions, they can move, into the blue, green side where they're actively seeking the vaccines or accepting them, or closer to the orange where I'm not so sure, I want to see about that. So it depends. It depends on the situation. It depends on the context and the vaccine being offered. And as I mentioned, most people, there's this very strong support in our region, happily, for routine immunization services. So if we think about how somebody is kind of perceiving risks related to vaccination versus risks related to a vaccine preventable disease, and where that would kind of put them on that continuum that we just saw, right? Generally speaking, if somebody sees that there is a high level of risk related to the disease, they are more likely to get themselves vaccinated or get their loved ones vaccinated, because they are seeing the risk of the disease. So polio, side effects of polio, if you think of the pictures from the past of iron lungs, people being paralyzed, this seems very high risk, right? versus the side effects, the potential side effects of the vaccine, or the high level of risk for the disease, more likely to get vaccinated. However, if people have a high level of risk related to the vaccine itself, whether this is true or not, whether it's based on scientific evidence, facts, reality or not, if they see a high level of risk related to the vaccine compared to the disease, they are less likely to get vaccinated or get their loved ones vaccinated, right? So I want to invite you all to take a moment, and we're going to open this Jamboard here and think about the different factors that can influence individuals' risk perceptions around vaccination and around vaccine preventable diseases. So if you'll see, we're going to put in the chat there a link to a Jamboard. And Juanjo, if you can put in this link, please, and then let's go as a group to this Jamboard. Okay, so the link is in the chat. Thank you, Juanjo. And what you'll see, okay, I see people are joining. Thank you. So there is a sticky note there that asks us on this first page, what factors increase the risk perception for vaccination? So what we can do is start writing sticky notes. And I guess maybe what I'll do is share my screen here, but it works better if everybody can open up their Jamboards with the link that we gave. Okay, so if for some reason you can't, you're now seeing some things. So in order to add something to answer this question, you can click on the side over here where it says sticky notes, and you click on that, and then you can write your text there. Okay, so we can see some answers coming in. Lo que pueden consumir por redes sociales o mensajes de WhatsApp. So information that we see circulating on social media or on WhatsApp. This is absolutely, definitely. Mal manejo de la información o poca educación del público sobre las vacunas. Okay, so people folks who maybe don't have very high health literacy, they don't know a lot about vaccines or vaccination. These are great. The education level of individuals can absolutely, in fact, influence more about the level of knowledge that folks have about vaccines or lack of knowledge, right? Let's see what else we have. Not collaborating with social leaders or community leaders in different areas. That's absolutely critical. That's great. Exceso de información. Okay, so lots of fake information, false, fake news on social media, personal fears that could come from what people have learned or their education, their culture. Culture, religion, absolutely. Side effects that could be related to safety, anti-vaccine groups, right? We mentioned before, there's not a lot of them, but they are very loud. They make up for their small numbers with very loud presence. What else do we see? We have fake information going viral. We're going to talk about that. That's a great point. We're going to talk about that later on. Why it happens so much? Why do they pick on vaccines? We're going to talk about that. Geographic location, right? News on the TV, right? Where this is also very important. Somebody wrote that the media tends to give more attention when things go wrong with vaccines because it's very sensational, right? And if it turns out that, something goes wrong and it wasn't even because of a vaccine, that's not so sensational, right? That doesn't get that same, number of clicks or views. So the media isn't giving that same amount of attention to things that go success stories, or when something isn't really related to vaccines as they do when there are potential problems, right? I'm sure we've all seen that evidence of that. Let me see, what else do we have? These are really great. These are awesome responses. Let's see. Yeah, negative experiences, right? If somebody has a negative experience at a health center, or they know somebody who has had a bad experience, that can also impact that risk perception, right? A lack of knowledge among the immunization teams, right? We talked about this, is why how the immunization teams are the vaccinators are the face of the program, right? And so if they don't have the communication skills or the knowledge to be able to address concerns or questions that that vaccine service users have, that can also impact that. Absolutely. Overall mistrust in the government and health systems, 100%. And I think that's something that we saw a lot with COVID, right? Where, when things become very politicized, it becomes difficult. And when there's a lack of trust in the systems that are meant to keep us safe in general, or a lack of trust in the government, it's hard sometimes for folks to have that trust that the vaccines are going to work, the vaccines are going to be safe. So these are absolutely very, very valid. These are just wonderful suggestions and things that everyone has written down here. So before we go back to my PowerPoint, where we're going to show some of the things that I wrote down, which really matches what y'all wrote here, let's go to the next slide. So if everyone, I'm going to move it, but there's a little arrow kind of at the top of the screen that you see I'm pointing at right now that says next frame. And if we click on that, move the screen away, let's do the same exercise, but we're going to talk about instead factors that can increase the risk perception for vaccine preventable diseases. So now we're talking about the diseases, not the vaccines. What are some risk factors, or what are some factors that can increase the risk perception for a vaccine preventable disease? Or things, in other words, that might make somebody think, why should I choose to get vaccinated? So same idea here. We can take our sticky notes and we can take our sticky notes and we can add to that. Okay, this is great. La gravedad de una enfermedad. Oh, let's move this guy down. So right, the seriousness of a disease, right? Or hearing about people who have been impacted by a disease, right? El miedo y el desconocimiento de su propia patología. Okay, so again, so fear of the disease. Maybe it could be the fear of getting sick, or could be the fear of dying, or from the disease, right? El problema es que muchas enfermedades no son vistas como riesgosas. The problem that a lot of illnesses or diseases are not seen as risky. So this is important, and we're going to talk about this in a moment as well, right? Maybe we've heard the phrase that vaccination has become a victim of its own success, right? We don't see when I mentioned before polio and was talking about the images, the old time images of children in iron lungs, right? That's not something we see anymore. So people don't really have that same fear, right? It's not something that's being seen. Same thing, we're not having pregnant people who are having miscarriages or who are giving birth to children who might have birth defects because the pregnant person had rubella when they were pregnant, right? So a lot of these things that were really quite scary in the past, we're not seeing it the way we used to, luckily, anymore, right? So same thing, the low incidence of vaccine preventable diseases, absolutely. The fear of spreading a disease to other people, absolutely, right? Even if I myself might not be concerned about getting a vaccine, I could be, or about getting a disease, I might be scared about spreading it to a niece or a nephew or a grandparent or an older parent. So spreading a disease, for sure, not wanting to do that. Concern about having to, go back to quarantine, absolutely. I think that's something that's going to stay with us as a public for a long time, right? Some people don't believe that these diseases that we can prevent with vaccination are still risk or still circulating. So that's like we mentioned, that's a great one. The advice from healthcare workers who aren't really encouraging vaccination at the level they should be. Absolutely. We know a recommendation from a healthcare worker to get vaccinated goes such a long way. So again, having those recommendations from the folks on the front line are just is critical. Okay, these are really, really great. You all have done a wonderful job thinking about some of these factors, and as we can see, there's a lot of them. And so it's not just, we can't say that it's just one thing, or if we just do, A, B, or C, we're going to resolve this. No, it's a very complex situation, right? That we have to consider. So I'm going to stop sharing this, and I'm going to go back to my presentation, and I want to again congratulate everyone. I'm going to keep that open. So if you think of other things that you want to add during the presentation, go ahead. But here are some of the things that I wrote down, and you can see that we were on the same page. So in terms of risk factors that can increase factors that can increase risk perception for vaccination, I think we talked about basically all of this, and we heard a lot of exposure to false information, messages on social media, etc. Something that I do want to mention that I don't know, maybe this was written down and I missed it, and I apologize if so, but I think something else could be an overconfidence, either in herd immunity or in somebody's like individual immune systems. So if you've ever heard somebody say, I don't need to get that vaccine, I take lots of vitamins, I eat fruits and vegetables, my immune system's fine. That's definitely something, right? Or overconfidence and herd immunity. Everyone else is vaccinated, I'm not gonna bother doing it. If you've heard somebody say that, we could classify that there. And same thing with the factors that can increase risk perception for vaccine preventable diseases. I think we talked a lot of these on the Jamboard. So again, excellent work of that. I think one thing that, again, if I missed this, if somebody wrote it on the Jamboard, I'm sorry, but mentioning also fragile health systems. So this was also something that, we saw at different points with COVID, right? Where we knew health services were being absolutely overwhelmed. And so, having this fear of, okay, well, if I'm not vaccinated and I get sick, am I going to be able to find somebody to help me? Is there going to be medication for me? Is there going to be room at the hospital for me? So wonderful work on that. Thank you all so much for participating. We'll talk about 3 other things that I didn't want to include as just a risk perception for a vaccine preventable disease or just for vaccination, because these are really things that can influence either one. And one of those is in communication, we talk about noise or a competition for the public's attention. So while we as health communicators are promoting immunization, promoting vaccination services, and anti-vaxxers are trying to convince people not to get vaccinated. Our messages, their messages, all these messages are competing. We are all bombarded all day, every day with messages that we see, you know, things we see on TV or hear on the radio or on social media or get in WhatsApp groups. So that noise or the competition for the audience's attention can influence that risk perception either way. Also, the social norms and opinions of respected community leaders, influencers. So this was something that we talked about, I think, on the first Jamboard. And this can go either way, right? Because we can also have respected leaders advocating against vaccination as well, right? So it can go either way. And then the economic factors, right? Did any of you hear when vaccines were first being introduced, anybody say, well, I don't want to get vaccinated because I heard it might, I don't want to get my COVID vaccine because I heard it, you know, it's going to knock me out for a couple of days and I can't miss work. I can't risk feeling poorly for, you know, a day or two and miss work, or, you know, I don't want to miss school. But at the same time, if you get the disease, you end up getting COVID and you end up missing work or school anyway for a longer period of time. So again, just, you know, these are just different things that you know, you might have heard people talking about in terms of, you know, their decisions to get vaccinated or not. So let's look now a little bit at the risk comms and community engagement principles and how we can apply them to communicating about vaccination. So here we are again talking about trust. And it's so critical to immunization programs. It's so critical to risk comms. And I'm really here to encourage you all that it must be prioritized. It must be something that we invest in. It's not too late to start. So it's, you know, if there have been issues in the past, or there have been, you know, these moments where trust has been broken and hurt, and that connection with our publics may have been broken, that doesn't mean that we should just give up completely, right? No, there's no time like the present to start, right? We can all leave this webinar and say, okay, how can we build trust with our communities so we can improve immunization coverage, right? So it's also an ongoing activity. That's the other thing. So it's not something that we can do once. Okay, we're going to do one trust building activity, or we're going to, you know, focus on this for, you know, 1 quarter of the year, and then that's it. We're going to check it off our list and move on to the next thing. No, it's something, in order to maintain that trust, it's something that must be invested in and prioritized on a continuous basis. So let's keep that in mind. Some principles for risk comms and community engagement. So in other words, what does an effective risk communications and community engagement, what do these activities look like when they're effective? Well, first of all, we want our communications to be accessible. That means we want to be using channels that our audiences use, whether this is PSAs on the radio, posters, print materials, social media, a lot of different channels, but knowing exactly the audiences that you're trying to reach, the best way to reach them, makes your communication accessible. We want our communications to be actionable, which means we're giving clear information that encourages the audience to take actions to protect themselves and other people, right? So the audience hears your message and knows very clearly, okay, they want me to do X, you know, or I should not do Y or Z, right? Credible communication is really important again, and here we are talking about trust again. We want our messages to come from trustworthy sources, and a trustworthy source is one that is transparent, so not trying to hide and not trying to, you know, push anything under, sweep anything under the rug, right? It's dependable, so we're following up. If we say, you know, I don't have the answer to this right now, but I'm going to get back to you with an answer, and then, you know, doing that, following through. and empathetic. And this is super important when we have to communicate about something that happened, something bad that happened, or a crisis. So understanding that, our audiences might have concerns, they might be scared, and seeing that, from a human perspective, instead of just trying to, brush it away or be, robotic about it. No, be empathetic, understand where people are coming from, why they have the questions or concerns that they do. We want our messages to be relevant so that the audience can understand why we're telling them this. So how does this message apply to me, right? We want to be timely, which means that, if there is an emergency, if there is a crisis, that health authorities are the first ones to inform the public what's going on, and saying what is known, what is still unknown, and how we are trying to know the unknown. So how information gaps are being filled. And I want to emphasize here that evidence or information here should not be rushed. Like, you want to be communicating correct information. Making, guesses or speculating is really not helpful. And it can be frustrating when there isn't a whole lot of information that can be shared, but you can save yourselves some problems and some potential complications if you avoid trying to jump the gun there. We want our communications to be understandable, which means it's simple. We're not using a lot of jargon. We're not using a lot of technical terms, right? It's just there and available and easy to understand. And then periodic. We want to let audiences know when they can expect more information. And then again, going back to that credible, dependable aspect, we want to follow up. So if we say we're going to give an update at a certain time, we want to make sure that we're doing that. So since we had so much fun with the Jamboard, we are going to do a quiz now on trust. And so we're going to use the platform Menti to use this. And so if you have a phone on you, you can use your camera and scan that QR code, and you can open Menti on the phone, or you can go to menti.com and you can use that code that we put there, which is 7253-2240. So let's take a second and join that. And I'm going to stop sharing my screen, and then Wanho has also put the Menti link in the quiz, or in the chat. Okay. So let's give everyone one more second to join our Menti. And when you open it, you should see the first question on the quiz, which is question 1. A journalist discovers that the local health authority recently covered up information about a severe SARS. As a communications professional, do you encourage the authority to All right, yeah, I think we can go to the options for the answers, Wanho. Should they apologize? Just admit the mistake and say sorry. Say nothing and hope it blows over. We know right now that the news cycle moves very quickly. People have short attention spans. At some point, this is just not people aren't going to be paying attention to this, right? Or blame the mistake on someone else. It wasn't our fault. It was the vaccine manufacturer's fault. It was the fault of the health worker. It was the fault of the other political party. If only they had made better investments when they were when they had when they were there. you know, we could have avoided this. So what do we want to do? Do we want to apologize, wait for it to blow over, or do we want to blame someone else? Do one more second to get our answers in. We already saw lots coming in, so thank you to everyone who has answered. All right, and Juanjo, let's see the correct answer. It is A, apologize, and it looks like we got lots of answers, lots of correct answers there. So we want to apologize for the past mistakes and talk about what we can do differently moving forward. When we have a heartfelt apology from somebody, especially somebody very high up, it can show the public that, you know, we recognize we made a mistake and we want to do better in the future. And again, this is a great way to build trust. Those other options are not good ways to build trust, because if we just kind of wait for it to blow over, you know, people are it's gonna come up again, right? And blaming is just, it's not a good look. So, all right, thank you. Let's go on to the next question, please. All right, question 2. The health authority decides to issue an apology based on your recommendation. Very good. Who do you suggest serves as the spokesperson to issue that apology? So who is going to go out and say, you know, sorry about this, we messed up, we're going to try to do better. All right, let's see the questions or the answers. Okay, so do we want to send many different people to different media outlets and hope that somewhere along the way the audience is going to see someone they trust on one of the different outlets, right? Do we want to send a bombastic politician who is really loved and respected by their political party but does not have that same respect by folks outside their party? Or do we want somebody who is neutral, consistent expert within the Ministry of Health or within the organization? What do we think? A, B, or C? All right, we see lots of folks coming in with question C or option C. All right, Juanjo, let's see the answer, please. All right, we want option C. Y'all were right. Somebody who's neutral, somebody who's consistent. This is especially important when immunization has been highly politicized, right? This was something we see with COVID. We'd want our spokespeople to have the audience's trust, and that's really hard to do if the individual is, you know, not speaking well about other people or being inflammatory, right? We don't want to alienate anybody in this situation. Another bonus of having, you know, a spokesperson like this is it helps ensure consistency of our messages across different platforms, which is helpful for the audience as well. So they're not hearing different things from different people at different times. That's also a way to break trust, right? All right, let's go to the next question, please. Okay, so question 3, which message would you not include in the apology talking points? What would you not include? Okay, let's see the options, please. Would we not say, A, experts around the world agree that vaccines are safe and effective? Would we not say, B, we promise this will never happen again? Or would we not say, C, we understand that this situation caused concern for the public and we're deeply sorry about that? What do we not say here? All right, we're getting lots of answers coming in, a little bit little bit more divided on this question. Again, we're looking for what we would not put in our talking points that we're going to give to the health authority when they go to issue the apology. All right, we're still getting some answers in, so we'll give it a couple more seconds. All right, thanks everyone who's been participating so far. We hope that this is that these little quizzes and jamboards make the session a little bit more engaging and fun. All right, let's see the answer. Let's go to the next slide, One Home. So what we do not want to say is, we promise this will never happen again. And why we don't want to say that is because we cannot make that promise. We do not know if this will happen again or not. And when you make a promise and you can't keep it, what do? We break trust, and we don't want to break the trust with our audiences, right? So what we do want to do is we want to be empathetic, right? As we talked about earlier when we were talking about our principles of risk comms and community engagement. We want to emphasize expert consensus on vaccine safety and effectiveness. And this is really important because this is saying, even if you don't trust me when I say this, you can trust all these other world-renowned experts and scientists who say that. So don't just take it from me, take it from all of these other experts, right? And then they start to see how that's aligned with the experts in that organization, and that's a way that we can again start to repair that trust. All right, we've got one more question with that quiz. Let's go ahead and see question number 4, please. And this question says, to demonstrate goodwill toward the affected public, the health authority holds a series of conversations with local leaders. What do you suggest is done with the concerns brought forth by these leaders, right? So basically you're having this sit down with the affected public. Let's see the answers, the options for the answers, please. Do we A, do nothing? They're not experts on this topic. They don't know what they're talking about. We had our little sit down. That was nice, done. B, do we develop a highly technical brief that explains why those concerns aren't really warranted, and then share them the brief? Okay, look, we listened to what you said, and here's our response. Or C, do we adapt our messages and approach and address the concerns that we heard during the sit down in a simple language that that we heard? All right, let's see, which option do we want? All right, C, we want to adapt our messages in simple language. Okay, if we ignore community feedback, or if we take that feedback and address it in a way that they will not understand, it looks very bad. It looks like, the sit down, the conversations, it was all just for show and we don't really care. And that can actually backfire on us seriously. So we want to always be listening and adapting. Thank you so much, Wanho, for helping with that Menti, and thanks everyone for participating. Let's go back to our PowerPoint here and talk about some practical guidance. And I'm going to run through this a little bit quickly because we have one more quiz to do, and I know we're approaching the end of the time, but I do want to emphasize that everything that I'm talking about from here until the end of the presentation is available in the publication that I shared earlier in the presentation. And so you can have access to this information, including in more in depth at that publication. Okay. So what is something we want to do? We want to have a crisis plan ahead of time. So before anything that even happens, we want to make sure we have our bases covered as much as possible. Okay, and this is, I mentioned this in the crisis communication material that Gabriella mentioned earlier in her presentation. If you want to know how to do this step by step, check out that publication, because it goes through the step by step. Something that I want to highlight from the slide, though, is that we want to be communicating about vaccine safety continuously. We don't want the audience just to hear from us when something goes wrong. And by communicating continuously about how vaccines are safe, how they are effective, we are building that trust. We are building a solid foundation so that if something happens, the audience already has that as background, right? So talking specifically about messaging, we want to pre-test our messages when possible, even if you don't have the money or the time to, do a fancy, survey or focus group. Ask a couple friends or neighbors or family members who don't work in the field of health what they understand with a message, and see if that matches with what you're trying to say. You want to simplify, right? We don't want to be too technical, too jargony, but we also don't want to be superficial, right? That's finding that balance. We want to lead with the critical information. What do we want people to know now? What do we want the takeaway to be? We want to include both oral and written messages so that we're covering our populations with different levels of literacy. And we want to explain technical terms that keep coming up. And that might seem like it goes against what I was saying with, we don't want to use a lot of technical language jargon. But I wonder how many people here had friends who don't work in health or vaccines or, anything related to anything, all of a sudden talking about, when COVID vaccines were being developed, talking about vaccine efficacy or vaccine effectiveness, everyone suddenly becomes an expert, right, on it. And so take the time, if something keeps coming up over and over again, if the media is going to keep talking about something like, vaccine efficacy here, the example I used that WHO did, take the time to explain and teach people the right terms from the beginning, right? We want to adapt messages according to audiences' needs, understanding that different audiences will have different needs and concerns. So here are some examples, and again, these are all in the publication, geared at pregnant women, at older adults, audiences that we know might have some extra concerns. We want to simplify our numbers when we're talking about ISAVI, because 1 in 10 million persons is easier to understand than, X number of thousands of people were effective. It's easier to help people frame that, right? Similarly, we want to use concrete numbers when we can, because if we just, always are relying on saying, oh, high or, low, people have different understandings of what is high or what is low. And so that can, when we use concrete numbers, we can kind of help bring people onto the same page. And we want to clearly label images with your logo, because that gives that authority, right? We want our messaging to be culturally and linguistically accessible. We can do that. We want to check translations with native speakers to make sure that we got it right. And we want our audience to see ourselves in their images too. And I love this. This is an example from Paraguay that I think is just really beautiful, that was done by an indigenous artist. And it helps, indigenous populations to see themselves and make sure that, they're getting that message too. We want to be transparent. We talked about this. This is an example of typical side effects of the COVID vaccine are, again, we're not trying to hide that you might not feel great after you get vaccinated. Here's the information. Here's what you can do. Here's when to contact a healthcare provider. We want to use storytelling and emotions when we can, because we know anti-vaxxers do this and it works really well for them, right? They tell these terrible, very dramatic, scary stories that are oftentimes made up or grossly misrepresented. We can also use storytelling to make people feel good about vaccination. And here I included a link. This is from a story in Bolivia about adolescent girls who got vaccinated against HPV and just how they felt. It made them feel really good and really secure about their futures. And so, we can also use the emotions to tell our stories. When it comes to risk perceptions, we want to emphasize the health benefits of vaccination at both the individual and population level. This was something that Dr. Salas mentioned at the beginning of the session, right? We don't want to minimize the risks of vaccination, but we can put them in perspective with the risks of not getting vaccinated, right? Like illness or death. So there's some examples there, and there are more examples in the publication. We can highlight the history of successes of vaccines, reassure people vaccines are safe and effective, and they have done what they were meant to do for years, decades. We can talk about benefits beyond health. Here's an example of an economic benefit that we're talking about. When it comes to pharmacovigilance, we can emphasize that public safety is a constant ongoing activity and that all vaccines are continuously monitored after they're introduced. There might be, we heard a lot about this with COVID vaccines, but this is not something that's only done for COVID-19 vaccines. This is across the board. And this has been the standard procedure in all countries for decades. This is nothing new. We're not reinventing the wheel here. Now, when we are introducing a new vaccine, we encourage folks to be ready to talk about ESAVI, because we know that there are sometimes in trials where it's just a small slice of the population. So something in a very, very, very rare ESAVI might not be picked up then. But when a vaccine is introduced into a general population, we might see something. So be ready to talk about that and remind people that it was picked up because the surveillance system works. And again, that's another way to build that trust, to build that foundation. We want to remember that trials measure different things. They take place at different times with different people in different contexts. And so, we can't just always compare apples to oranges. It doesn't work like that. So again, remembering context. And then we also encourage folks to stay informed, especially in international news, because the world is so small. So something that happens with a vaccine in another country, that same vaccine is used in your country, can cause a stir. So just be aware of what's going on, right? We have one more quiz about false information, but I want to talk about this because I promised we would come back to it. False information about vaccines is everywhere. Why is this so? Well, first of all, rumors are invented quickly. Anyone can jump onto Facebook or Twitter or wherever and write whatever they want. The COVID vaccines have microchips, total nonsense, right? But taking the time to refute these rumors, you have to research, you have to word it correctly, right? It takes more time. We know there's limited oversight on social media platforms. There's, a lot of false information on a lot of different topics is being spread on there, and there's, a limited response from the platforms themselves. We know that sensational, emotion-inducing content goes viral more easily. We talked about this in the jamboard, right? When the media pays a lot of attention to, something that has gone wrong related to a vaccine, or, a potentially deadly ESAVI. And then when it turns out that it has nothing to do with the vaccine, it doesn't matter. That story is not as sexy to sell. It doesn't go viral the same way. So we know that false information just spreads like wildfire. Echo chambers online can reinforce misconceptions, right? And then rumors shift and meld as they spread. So as we are taking the time to try and respond to the false information that's popping up, the rumor that we're originally responding to has already started to shift and be combined with another rumor. And so we're facing new rumors. So it's just a constant battle, right? I talked a little bit earlier about pre-bunking. This is something that happens before people are exposed to false information. We can kind of think of it as a vaccination against false information, right? We are giving people a watered down, a weakened version of the false information that's out there, and saying why it's incorrect and talking about what the correct information is. We're giving people this warning, and we're offering them the correct information from a trustworthy source. Pre-bunking also encourages our audience to think rationally about what they're being presented with, and it also can teach individuals how to spot false information and what the different manipulation tactics are being used. And here's just a few of them. This could be a whole other webinar. Cherry picking data, right? Just using little snippets, little parts of data that serve the story, right? Inventing quotes or experts or stories, preying on emotions, making people feel scared, sad, or uncertain. Those are very powerful emotions. Creating false dichotomies, right? Either or, and neither of the answers is correct. Red herrings, or just trying to throw people off track. And pre-bunking can also teach people to think about who benefits from false information. So somebody who's selling herbal supplements or vitamins or something, and they're saying, people don't need to get vaccinated because they can take my supplement and they'll be fine. Of course that, people who are trying to sell something, might be quicker to discount or to spread some fake information. So thinking about who is benefiting from this information that's out there. And also super important to know that social listening strategies can help you to refine your pre-bunking messages, because you can target them against specific pieces of false information. So you pick up that's out there and you can get in there with correct information. So here are some examples. Because of a lack of time, I'm not going to stop on these, but they are in the publication I shared. Let's talk real quickly about debunking, which is what happens after people are exposed to fake information. This is where you present the facts of the matter. If you're going to discuss the myth, you clearly label it as a myth. The timing here is really sensitive, because on one hand, if you have sensitive information, you hear that there's a new rumor that could be out there, there's a chance it might fizzle out, right? So you don't want to jump too early on it. But on the other hand, if the false information is just spreading and spreading and spreading, then it's a little bit too late. So you want to get kind of like right in the middle. Remember that even after you debunk something, false information is very sticky and it stays in people's memories. So keep that in mind. Even when you replace the information, you corrected it, it can still stay there. And again, social listening is critical. So let's look at this example real quick. This is an example that was done from the Eastern Mediterranean Regional Office of WHO in January of 2022. Here's the myth. It's clearly labeled as a myth. There's a big red bubble that says myth around it. Millions have died because of COVID-19 vaccines. And then on the other side, here's the fact. Here is the actual truth. And let's look real quick. Again, example of how false information travels so quickly. This myth is quick, it's easy to read, it's simple, it's concrete, it's emotional. The facts, just trying to debunk that one myth, people have to read more, it's more complex, it's longer, right? So let's quickly do our next quiz. Again, you can use the QR code with your phone to open up this quiz. We are almost done with the presentation. Or you can go to menti.com and put in the code 1927-4144. And I'm going to stop sharing. And here's the quiz in the chat again. And let's open up that quiz. And we have 4 questions like before. The first question in our Menti: anti-vaxxers like US politician Robert F. Kennedy work for free to advocate against vaccination? I'm already going to tell you the options are true or false. So take a minute, look at this question and think, is this statement true or false? All right, let's go to the next page and see the options. True or false? Anti-vaxxers like US politician Robert F. Kennedy work for free. True or false? Are they doing this out of a commitment to their own incorrect beliefs? Or are they doing this to make a buck? What do we think? True or false? Anti-vaxxers do this for free. False. Okay. This particular example, just last month, the New York Times reported that RFK earned millions of dollars in 2021 by fighting against vaccination. He personally, as an individual, made $2.25 million by being an anti-vaxxer, and his quote unquote charity, which is an anti-vax organization, made $15.6 million in 2020. So again, we're encouraging the audiences to think about who is benefiting from this, okay, to the tune of millions of dollars. Let's see the next question, please. Mary claims that there have been 22,000 ISAVI reported following 3.6 million doses of a vaccine. But Mary doesn't describe what the ISAVI are. Are we talking about arm pain at the injection site, or are we talking about a severe allergic reaction? She doesn't say. She also doesn't note that the reports are entered by any individual to a public database. So they're not verified. Anybody can be putting anything into this database. Mary is, let's see our options. Is she inventing experts to tell her story? Is she cherry picking data? Is she creating a false dichotomy? Or is she trying to earn some money? So again, the question says that Mary is talking about there are 22,000 ISAVI reported out of, I think I said 36 million doses of a vaccine that are administered. But Mary does not say what type of ISAVI we're talking about, and she doesn't note that anybody can enter the data into this database. What is she doing? All right, we've got a variety of options here. Let's see the answer. Answer is B, cherry picking data. She's only sharing the part of her data that supports her belief, and she conveniently is leaving out the critical information that gives the whole picture, right? All right, let's get to the next question. Question 3. You're in a heated discussion about the MMR vaccine with your neighbor, Santiago. When you share data published by the Ministry of Health about vaccine safety in your country, Santiago says, well, you're just paid by the pharmaceutical companies to say that. Santiago is, let's see the options for the answer. Is he using base rate fallacy? Is he cherry picking data? Is he creating a false dichotomy? Or is he employing a red herring? So again, people, you're talking to Santiago, you're trying to have a logical, rational conversation, right? And when you try and give Santiago the correct option, he says, you're just paid by the pharmaceuticals. What is he doing? All right, let's see the answer. Juanjo, please. He's employing a red herring. He's trying to shift the topic. He is not interested in talking about your data anymore. He's just trying to make an excuse, change the argument. So now all of a sudden, instead of talking about the data and the facts that you're presenting, you're defending yourself. I don't work for a pharmaceutical company. I'm just trying to tell you the truth. He's shifted the argument. He shifted the story away from the facts. All right. Next question, please. Last question. Aunt Sandra has posted an image on social media that says, if the COVID vaccine works so well, how come vaccinated people can still spread the disease? Aunt Sandra is, let's see the options, trying to make money, appealing to fear, creating a false dichotomy, or inventing experts. So remember, she has said Her message says, if the COVID vaccines work so well, how come people can still spread the disease after they've been vaccinated? What do we think? All right. Variety of answers coming in. Let's see the final answer. Let's see. Okay. Creating a false dichotomy. She is presenting only two options to answer her question, and both of these answers are false. So she is saying either the vaccines prevent 100% of transmission, or they have totally failed. They don't work at all. They don't serve at all. So we know that those are not the only two options. And in fact, you know, she's just trying to present that. And I'm sure a lot of us have seen that, right? So thank you for participating in the Menti. Thank you, Wanho, for sharing that. I have one more slide, and then we're going to close up. And I just wanted to mention, because this is really important as well, collaborating with partners is really important, not just for dealing with false information, but for communicating in general about vaccination-related risks. So with journalists and editors, we know, we've already talked about this, that the media loves sensational stories. And so we can work to educate them, talk about how safety data is calculated for vaccines, teach them those key terms. So we have the, vaccine efficacy, vaccine effectiveness, like I mentioned earlier, right? With the education sector, wouldn't it be great if students learned, just like they learn about the importance of a healthy diet or the importance of exercise, the importance of vaccination? Wouldn't that be fantastic? That's something we could work out to collaborate on. Our health workers, again, so critical. This includes health promoters and community health workers. Helping them to know how to communicate about vaccine risks and safety, what to expect following vaccination, et cetera. Communication is a skill, and like any skill, it can be taught and practiced. So this is something that really should be invested in. Academia and NGOs can help with social listening, fact checking, helping us to respond, debunk when there's false information out there about vaccine safety issues. And then, of course, our communities, right, where we want to build trust, we want to be listening, and then adapting our messages and adapting our approaches always so that we are responding to the issues that are being raised. And this is in addition to all the other recommendations for crisis comms that I mentioned earlier. So thank you all so much for your attention. Thank you all so much for participating in the Jamboards and the quiz. Really appreciate that, and hope you got something from this presentation. Thank you.
Muchas gracias, Lauren. Vamos a comenzar con el espacio de preguntas. Recuerden que pueden hacer sus preguntas en el espacio de Q&A. Tenemos varias relacionadas a la grabación de este seminario virtual y los materiales. La grabación y las presentaciones las compartiremos en nuestra página web. Pueden visitar en los próximos días la página de este evento y verificar las actualizaciones. También tenemos un comentario de Carla Valentina Hernández Soto que nos dice: lo ideal es no perder la confianza de la población. Pueden encontrar más información también y consejos de cómo fortalecer esa confianza en los materiales que hoy estamos compartiendo. Recibimos también algunas preguntas al correo o al espacio privado y me gustaría compartirlas acá para que nuestros expertos puedan responderlas. Cuando publicamos mensajes en las redes sociales sobre qué esperar después de la vacunación, es decir, los SAVI potenciales, recibimos preguntas sobre si las vacunas son realmente seguras o no, cuáles debemos contestar y cuáles debemos dejar porque pueden ser de trolls. Lore?
Thank you, Evelyn. Thank you for that. And thank you for whoever sent that question. One of the recommendations that is made in the publication is to develop a policy about dealing with trolls. And this is going to be something that depends. Every organization can make their own decision about how they want to handle this. But in general, anybody who's monitoring a social media account can probably start to see if you have followers that are often interacting with you or your accounts, who's genuine and who might have a sincere question that you are going to want to respond to versus somebody who's coming in and kind of just trying to, with the intention to antagonize, where they're, you know, trying to stir up emotions. Again, we talked about with the anti-vaxxers, how the you know, preying on fear, preying on emotions is something that anti-vaxxers and trolls do. So in that case, those are the types of comments that you would want to just, you know, ignore probably. But every organization should take the time. It's really important to make that plan for dealing with trolls. Thank you.
Gracias, Loren. Marco Acuña pregunta, ¿qué le parece judicializar el rechazo de los padres a la vacunación de los niños?
Quizás puedo tomar yo esta pregunta. No, mil gracias por la pregunta. Es un punto sumamente importante. Creo que de todo lo que hemos conversado hoy durante este webinario y todos los elementos, un elemento esencial ha sido eso de empatía. Los padres tienen preguntas sobre las vacunas para sus hijos, obviamente cuidan a sus niños. Tener preguntas es algo de sumamente natural y algo que queremos animar, porque quiere decir que la persona está interesada en el tema y queremos aprovechar de este interés para compartir informaciones. Entonces, juiciar siempre, no queremos juiciar, siempre es un problema porque corta esta tentativa de comunicación inmediatamente. Entonces, si un padre presenta pregunta o aún un rechazo abierto, podemos utilizar nuestro juicio en ver si es el caso de interactuar con esta persona. Como dijo Loren al inicio, hay personas que nunca jamás cambiarán su idea, pero es una proporción pequeña. Para la mayoría de las personas, la mayoría de los padres, muchas veces un pedido de informaciones adicionales o un pedido por lo menos de interactuar para obtener un punto de vista diferente o informaciones adicionales. Entonces, y el juicio corta todo esto tentativo de interacción. Entonces, donde posible, siempre intentar de comunicarse con los padres, pasar la información, quizás durante un solo encuentro, una sola comunicación, no se obtendrá ningún cambio de comportamiento ni de idea, pero ya se instauró un diálogo. Y a través de este diálogo, en varias oportunidades, se podrá avanzar quizás un poquito. Y recordamos que aún la vacunación de un niño más ya es un logro para nosotros, o de una persona más. Veo que Felipe tiene su mano levantada también.
Sí, gracias.
Adelante, Felipe.
Sí, gracias. ¿Me oyen bien?
Sí, sí, escuchamos bien.
Sí, gracias. No, sobre la pregunta de Marco, es importante resaltar que esta fue una pregunta que se abordó bastante durante la vacunación contra COVID-19, no solamente en el caso de vacunación de niños, sino también en adultos. Y es necesario entender que es una discusión bastante compleja porque cuando hablamos de judicializar el rechazo a una intervención en salud, estamos hablando de un conflicto de derechos, de múltiples derechos que deben considerarse dependiendo del contexto nacional para poder tomar una decisión. En general, la posición de los gobiernos ha sido a la no judicialización de la no vacunación por parte de los niños. Digamos que se ha tomado un abordaje más flexible, menos punitivo para poder lograr la confianza de la vacunación. Se tiene que entender que hacer obligatoria la vacunación y judicializar la no vacunación puede tener el efecto contrario. Puede, en lugar de favorecer la vacunación y la aceptación de las vacunas, lo que puede generar es un rechazo mayor y además generar una carga adicional al sistema judicial y a la Policía Nacional. Entonces, es muy importante, digamos, que se ubiquen estrategias adecuadas basadas en la confianza, como dice Margarita, y también por eso es importante aprender a comunicar, digamos, no forzar a la población o no forzar una idea, sino aprender a comunicar y a informar objetivamente, como es lo que se está intentando resaltar en este webinario también.
Muchas gracias. Vamos a la siguiente pregunta de Claudia Cerón. ¿Cómo hablar de SAVIs graves? Adelante, Loren.
Gracias, Evelyn, y gracias, Claudia, por la pregunta. Ese es un tema también que podría ser un webinar en sí, pero para contestar, porque requiere mucho pensamiento y es un tema complejo, puedo sugerir dos recursos que tenemos en OPS sobre este tema. Uno es la publicación, la comunicación de crisis, sobre comunicación o sobre vacunación, que va paso a paso de lo que podemos hacer, con quién debemos hablar. Además es como interactivo, la gente puede ir escribiendo en el libro, haciendo un plan. Y también el curso virtual que también Gabriela mencionó que acompaña esta publicación, puede ingresar. Cualquier persona, es gratis, y hacer el curso para ir pensando. Y la idea es, después de usar estos materiales, tener un plan de cómo hablar de una SAVI, sea grave o sea más leve, pero para cualquier situación. Así que recomiendo estos recursos que son muy, muy, muy valiosos, creo.
Muchas gracias. Vamos a continuar con la pregunta de Maynard Pontillo. Perdón si no estoy diciendo bien el nombre, pero la pregunta es, are there instances when we can bring back anti-vaxxers to believing in science and factual information, or should we just focus to inform those who lack information rather than those who antagonize it? Adelante, Lauren, por favor.
I mean, we never want to say never. However, that being said, we know that most of the time, our efforts as health communicators or health professionals are better spent responding to those people. If we remember the continuum where we had the folks, the green and the red, right? And with the red being totally anti-vax, and then in the middle we had, like, the light green, the orange. The folks who are there who are kind of questioning, maybe about a specific vaccine or in a specific context, those are the folks where, if we invest in interventions there for responding to their questions or responding to their doubts, where we're going to see the most movement towards vaccine acceptance or demanding the vaccines. And that's what we want, right? The amount of investment that would be required to get, all those, the small but vocal folks in the 100% anti-vax group, it would not be worth it. That investment can be so much better made for the people who have questions about specific vaccines or somewhere in the middle, and especially when those, questions could more easily be, it's just a matter of listening empathetically and responding with the correct information.
Mm-hmm.
Gracias, doctora Margarita. Adelante.
Yes, thank you. If I can add two more points to Lauren's point about not devolving, not focusing so much resources on those whose minds have been made up. On the other hand, there is great value in understanding what materials they're using and producing in order to promote their anti-vaxxers materials, because those are the materials that other people who may be more on the fence are reading. And that's where our activities in pre-bunking and debunking can really be useful, because we know what the materials out there are saying. We know that there's a large portion of the population who reads them, maybe not completely believing in them, but who reads them nonetheless and use them to make up their own minds. So that can also be useful material for us to create our response materials for pre-bunking and debunking. And the other thing that I wanted to mention, the question that talked about providing information. And we know that simply, the COVID pandemic has shown it quite clearly, simply providing information is hardly ever enough. Those who are already convinced may read it, but others might take a longer time or not read it at all. And that's why many of the strategies and techniques that we've discussed in this webinar really go beyond simply providing the information and engaging with the public, answering their questions. Also because no brochure or document that we will ever publish can include all questions and concerns of every single individual. So it's engaging in these communication conversations, ongoing dialogues, where we really understand what people's concerns are and we can address them directly.
Muchas gracias. Vamos a pasar a la otra pregunta de Aide
Evelyn,
Martínez.
Sorry, can I add one other thing? Because Margarita just made a great case for social listening, and it's so important. And if anybody wants some tips on, different strategies that can be used for social listening to identify what those materials are that the anti-vaxxers are sharing. Another plug for the material for the new book. There's recommendations in there about collecting information, whether it's on social media, whether it's collecting questions that journalists make during press conferences, questions that received on hotlines. So there's a lot of different strategies, and it's something that we also really encourage investing in, because it does give you that idea of what the concerns are out there, what the misinformation is. And it's a really important tool for communicators to use.
Muchas gracias, Lauren, por complementar esa respuesta. Vamos entonces a continuar con la de Aide Martínez. ¿Considerar reparación económica ante SAVI grave? Felipe, por favor.
Sí, gracias. Esta es una pregunta que hoy día se están haciendo varios países de la región de las Américas. Los sistemas de compensación tienen una larga historia en los países desarrollados. Sin embargo, en nuestros países hace falta una discusión más intensa sobre cómo se puede justificar un sistema de compensación por eventos adversos y cuáles son igual los derechos que se van a ver en conflicto cuando tomamos la decisión de pagar. Al final hay una consideración económica, y es cuál es el efecto que puede tener en la disponibilidad de vacunas, en la compra de vacunas y el acceso a vacunas, en la creación de un sistema de compensación. Entonces, digamos que no es una pregunta sencilla, no es una pregunta que se deba responder a la ligera, y no es una recomendación que una organización deba o no deba hacer, sino es una discusión que internamente cada país debe tener acerca de cómo se puede reparar, si es necesario reparar, y cuál es el monto de la reparación que podría recibir una persona que sufra de un evento adverso. Esas discusiones, como lo menciono, están en curso en los países de la región, porque son muchas las consideraciones que hay que tener en cuenta para tomar una decisión como esta, pero efectivamente sí, digamos que es una opción para muchos países, y los sistemas de compensación tienen una historia larga en países desarrollados. Cambio.
Muchísimas gracias. Hemos terminado entonces el espacio de la ronda de preguntas. Gracias a nuestros expertos por responderlas. Vamos entonces al último punto de nuestra agenda. Invito a la doctora Margarita Ghiselli. Ella es asesora regional del Programa Especial de Inmunización Integral de la OPS y nos brindará unas palabras de cierre. Adelante, por favor, doctora.
Mil gracias a todos por su participación, mil gracias a los panelistas por sus intervenciones y por supuesto a los intérpretes también. Solo unas pocas palabras porque ya hemos hablado muchísimo y se presentaron varios temas que creo han sido sumamente importantes para brindar recomendaciones muy prácticas a los ministerios de salud, a las oficinas país de la OPS, a todos socios sobre cómo comunicarse sobre seguridad de vacunas. Todo hemos vivido a través de la pandemia contra COVID, donde este tema ha sido de suma importancia. Entonces es importante continuar estos canales de comunicación y de diálogo con el público, con los trabajadores de salud, porque se sepa que eso no es un tema relativo solamente a la vacunación contra COVID, pero puede tocar a cualquier biológico y honestamente a cualquier otra intervención de salud pública que un país propone a su población. Como hemos visto en la primera presentación de Gabriela, la OPS ha publicado varios documentos y orientaciones sobre diferentes temas de comunicación sobre inmunización y vacunación. Sin embargo, este documento específico contesta a un pedido particular, específico, a una brecha que varios países han identificado durante la pandemia y ahora en este periodo post-pandémicos, para cómo continuar el diálogo, cómo mejorar y continuar el diálogo con su propia población sobre seguridad de vacuna. Y de verdad termino con una citación de un antiguo director del CDC de los Estados Unidos, Dr. Tom Frieden, que dijo que los ministerios de salud, los agentes de salud pública, sobre todo en situaciones de urgentes, deben ser los primeros en comunicarse con el público, brindar información correcta, brindar información creíble y hablar de manera empática. Entonces, en inglés, be first, be right, be credible, be emphatic. Y eso creo son puntos esenciales para continuar a mejorar los enlaces de confianza que Lauren mencionó en toda su presentación entre los ministerios de salud, los agentes de salud pública y la población. Y de verdad esperamos que este webinario, estas orientaciones técnicas le han brindado herramientas para continuar este diálogo y poder implementar este lema. Entonces, termino aquí. Otra vez agradezco a todos su participación activa en todos los ejercicios y mil gracias también a los que han elaborado y contribuido para realizar este webinario. Mil gracias y que tengan un buen día.
Muchísimas gracias, doctora Giseli. Gracias nuevamente a todos por su participación y unirse a este seminario virtual. Los invitamos a continuar visitando la página de la OPS para enterarse de los próximos eventos virtuales. Que tengan todos un buen día. Hasta la próxima.